Director, National Primary Healthcare Development Agency, Dr. Fasha Shuaib, has appealed to Northern traditional leaders to make good use of their office in boosting political ways in the area of polio funding to achieve zero tolerance to the virus in the country. He gave the charge Monday in Abuja during the second quarterly meeting with the Northern traditional leaders to review the state of compliance on primary healthcare delivery across the geopolitical zones. With barely 1 year Nigeria attained its white polio-free certification, there has been reported cases of vaccine-derived polio virus 2 in some states. This has continued to raise concern as most funding donors have withdrawn due to the certification. The executive director, represented by Dr. Usman Adamu, said it is imperative the nation is guided jealously to avoid further community transmission, noting that with the outbreak response strategy conducted in the affected states, there are a high number of missed children during the exercise, hence lamenting the poor quality which will have an adverse effect to contain the outbreak. Dr. Fasha, while soliciting for the Northern traditional leaders' support to galvanize resources and manpower to attain the desired result on the polio outbreak, commend them for their stride toward curbing the spread of COVID-19 in Nigeria, especially at the community level.
We have CBD-PV2 outbreaks in Abia, Bayelsa, Borno, Delta, FCT, Jigawa, Kano, Kebbi, Lagos, Niger, Rivers, Sokoto, Yobe, and Zamfara states. And we have conducted 4 outbreak responses using the novel oral polio vaccine, which is preferred as a choice as it doesn't seed the virus. However, suboptimal performance has been recorded in all the states due to high numbers of missed children during the outbreak responses. This poor quality will affect how we are able to bring this outbreak under control. Your Highnesses, it is pertinent to state that donor funding for polio has drastically reduced. We will therefore be relying on your influence in advocating to political leaders on the need to continue to fund polio outbreak response campaigns.
Also, the chairman, Northern Traditional Leaders, Alhaji Samaila Mera, speaking on maternal mortality rate in Nigeria amid COVID-19, calls for more sensitization on the part of the government to ensure a general acceptance of the vaccine to eliminate bias.
High coverage is still poor, and the cases of maternal mortality are still unacceptably high in our community. I'm encouraged and proud of the action taken by some members of this committee who presented themselves publicly vaccinated. I suggest the MPSDA and the Presidential Task Force Committee on COVID-19 should take advantage of the ability of such images of community influencers across the board to motivate the general population to accept the vaccine.
We also have to reflect on how COVID vaccine can help boost routine immunization and also position Nigeria in a place where immunization is at the center of our primary health care. Over the next 2 years, there will be a malaria vaccine. If we could use COVID-19 vaccine, routine immunization, and introduce malaria vaccine to the greater benefit of all the population in Nigeria, we would have started much earlier than anybody else.